Welcome back to our second episode of the Neural Network. I'm really excited to talk to you today about evaluating GPTs. As you remember, the first episode we made was on how you create a GPT. And
Right.
so, you know, by natural process, the next question someone should have is, you've created something, how good is it? Does it work for the context that you created it for?
Right.
We're hoping people are enjoying our newsletters. We'll put out two on neural networks and large language models. So really hope that, if you haven't had a chance to look at that, that you go and read those summaries, which are really meant to create some sort of a knowledge base and give you some practical tips on how to use AI in healthcare. Let's get started.
Yeah, let's jump to it. So we do have a framework in place. It's called a quick TEHAI assessment for GPT in clinical practice, in which we'll assess the capability, the utility, and adoption for your custom GPT. So let's jump into the questions.
Yeah, so first I want to give a shout out to where TEHAI was developed. Dr. Sandeep Reddy from Australia, prolific voice in AI and healthcare. Really recommend you follow him on LinkedIn. Developed this in 2021 through collaborations with the UK and US. And it stands for Translational Evaluation of Healthcare AI Products. And so it was really made for a healthcare setting and AI products in that setting. Why don't we start off with the capability and work through the rest of the model from there?
Yeah, so the first question is evaluate your model's ability to enhance decision-making, reliability, and knowledge provision. And this is really about find your own use case, because one thing that we believe in is that we should narrow down the use cases and find use cases that are actually helpful to you.
Yeah, great question and great point. And I think that the more narrow your use case is, the better the chance that the GPT won't let you down and that you can evaluate it properly with specific metrics. So, for example, with the pneumonia GPT, I should say that most of the guidelines I fed it were all related to bacterial pneumonias in the inpatient and outpatient setting. And it was more developed as a tool to help clinicians choose the right antibiotic to treat patients that they may have already diagnosed with pneumonia. It wasn't really built around specific thoughts around how do you diagnose the pneumonia? Can I feed it a chest x-ray or a CT scan and ask it to diagnose the pneumonia? Or can I use it to develop information that's a leaflet for patients on understanding pneumonia? Although I did feed it one document that had that, I think if you look by and far, the knowledge base that I put in was more on treatment guidelines and IDSA guidelines and tips and tricks on clinically treating bacterial pneumonias. And so I would say that would be the most adequate use case for the pneumonia GPT that we created, for example.
Right, that's very good. So next question. Your data set, your knowledge, where did they come from? Are you actually allowed to use them? What are you using them for? So this is a question that we often have to think about. And here's a very interesting prompt that I encourage everyone to try. It's something called a prompt injection, in which the prompt asks for the list of documents or sources provided to it as context. And the goal here is that your custom GPT does not leak your documents to every user that asks this question.
Yeah, for sure. And I think my hope is that when GPTs are released, people are open and transparent with the resources they use to put together their GPT. I mean, I think if they're selling something, they might not want to be as transparent because, of course, if you have the resources, and they're usually free open access resources, you can make your own GPT using that in 5 minutes and don't need to pay for someone else's GPT. But my hope is that people are open and transparent so that you understand what has gone into building the GPT, and whether it's relevant to your context. Is it the right IDSA guidelines? Is it what you follow in your local practice? And you also have to realize that some sources may not be open to sharing their information. For example, UpToDate, which a lot of clinicians use right now to answer some of these questions, has discouraged people putting their data into OpenAI or LLMs. So you might not be able to have that information in GPT, although it would be great if you could, because then you could just search your GPT through the up-to-date guidelines, and it would be so much easier to read than having to spend 5 or 10 minutes going through a big article to find an answer. So I think that's still an area that is developing, and the hope is something like Up to Date puts together their own GPT. But for now, you want to make sure that the GPTs you're using has information that's free, open access, and that you understand what's in it and it fits your local context.
Mm-hmm. Well, the next one that we're going to touch upon is performance metrics. And this is going to be useful if you're going to share your custom GPT, because people want to know how good it is. So one of the things that comes to mind is, what metrics are you choosing to evaluate your GPT? So there are a couple options here: accuracy, truthfulness, helpfulness, clarity, interpretability. So these are metrics that are very interesting to custom GPTs. And the reason here is you have to understand why actually you're choosing these GPTs and why you're actually choosing these metrics to evaluate these GPTs.
Yeah, for sure. And I wonder if many of the GPTs won't have these metrics because people haven't had a chance to robustly test them yet. But I think one of the big areas that will need to be looked at once a GPT store is open and these healthcare apps come out and these healthcare GPTs come out, is putting them through some sort of testing through multiple prompts of your use case with different contexts to see, is it accurate? And a question will be, how many cases do you need to put in? 5, 10, 20, 100 before you can truly say that you have good accuracy? And I think there's no real guidelines across that right now, but I think the more information you have, the better you can look at something like accuracy, truthfulness, and the metrics you talked about.
Mm-hmm. I really hope that with the advancement of AI for healthcare and collaboration between researchers and clinicians, we're going to establish more benchmarks around these metrics and eventually have a robust testing framework to evaluate our custom GPTs. So the next one we want to touch upon is on assess how well the GPT adapts to your specific clinical context. And this one, we have prepared a question in which we ask it to provide a treatment plan for a male with COPD in a rural area with limited healthcare resources. Because if you're practicing in a rural area, you want your custom GPT to be helpful in your specific cases.
Yeah, and I think even on a more broad spectrum is, we know that these LLMs have biases and they may not apply, the knowledge equivalently to different race types, to different ethnicities. And we know that clinically, sometimes looking at a patient in one context can be very different. For example, in different countries, if the 65-year-old with COPD was in India or China, there may be different infections that you're worried about as opposed to in Canada or in the United States. And so you need to take those things when you're looking at the generalizability of the actual GPT that you're using. And even if it has specific data, for example, there's antibiogram data looking at, which antibiotics work for different bacteria. And that antibiogram data is going to be different in different countries and different regions. My GPT doesn't have that information, but you might ask yourself, could you include that information? And if you do, then perhaps, it might be a really good pneumonia GPT for the specific area where it has antibiogram data, but not be as good and generalizable in other countries and other contexts. So that's something to keep in mind.
Yeah, or the next category is safety and quality. So this is very important because there's two parts to your GPT. One is the source you put in, and one is just the GPT model itself. And as we know, the GPT model is not static. It's constantly being updated. And your source might not be up to date by the time that you put it in and by the time that you're actually using it. So it's very important that you have ongoing monitoring and governance mechanisms to actually check if your model is still valid.
Yeah, for sure. And guidelines change. People publish new guidelines every few years. And so you want to make sure the people that are publishing their GPTs are up to date with that and they're transparent about what information they included, if they have the latest guidelines or not.
Right. So next part is, it's also a very, very important part is transparency of the GPT. So does it operate as a black box, or can you actually understand why it gave you the answers in that way? And it's very important for GPT to actually be transparent. And in this case, we have prepared a prompt, which is to give a treatment plan for, again, the 65-year-old male with COPD. But this time we asked it to explain how it would treat this patient, and how also tell me how to treat their COPD in this context. And a very important thing is providing reference to the treatment guidelines that was provided to it as context.
Yeah, and I think what we're trying to illustrate here as well is that, you know, you can write a really good prompt that asks the GPT to be transparent and share its thought process. That's something that you might be able to add into your prompt itself, which might be very helpful. So when you are using these GPTs, perhaps a neat tip and trick is, if you're using it for very important decisions, ask it, you know, to reference what it used, so that you
Hmm.
know where its information is coming from, as opposed to saying, you know, here's my patient, how do I treat it, period. And
Hmm.
assuming that it's going to go through the IDSA guidelines that you provided it, just ask it to. That way, you know that it's gone through that process,
Hmm.
as opposed to assuming that it's gone through that process.
Right. And it's very important that you actually check for those explanations, because the last thing you want is to just have the GPT provide you with a simple answer and you believe it all the way. So the
Yeah.
next thing we want to talk about is privacy. So in this case, actually, we have prepared two prompts in which the first one contains personal information and the second one asks it to provide the personal information. However, it's important to note that these sort of first prompts that we have here that contains personal information should not be put into your conversation with the GPTs. So the first foremost is do not have personal information included in your conversation. However, it is also important that we have some protection mechanisms in our prompt in which we reject the leak of personal information that was accidentally shared with the GPT. And that's why it's important.
Yeah. And I think the biggest thing to highlight here is, do not put in personal information, clinical personal information or patient information into any GPT, because it's certainly not safe, it's not HIPAA compliant, and you could certainly get into a lot of trouble at your institution, or even with your college. But if you somehow end up doing something like that, I think this technique here helps you look at whether the GPT is retaining that information or not.
Great. So the next question is also important. It's time efficiency. Is how long does it take for you to actually get an answer? Right, because sometimes custom GPTs can be slow, and it takes 2 to 3 or even 5 minutes to get the full response if you require, multiple ongoing conversations to help it to, assist. So this is something that is very important to think about, time efficiency and how long does it take for you to actually get the answer.
Yeah, and I think that dovetails really well into the adoption piece. Because if you're going to adopt a GPT or any sort of AI product, you got to ask yourself, where does it fit into my day-to-day tasks? Something like the pneumonia GPT, I would say would be harder for family doctors to use, because they have one sit down with their patient, they have 10 or 15 minutes, and it would be a bit awkward to pull out their cell phone and have this conversation with the GPT in front of a patient. They kind of have to make a decision about what they're going to do in that one sit down. Whereas if you're working in the ICU or in the emerge and you have multiple visits with the patients, you can go and use your phone in between that time, and really go through information before making a decision. So it really depends on the context whether you can use some of these GPTs, and the best person to answer that is you, because you know your own clinical workflow and you know whether GPT would fit into it or not. And so you have to ask yourself that before you use something like this.
Right. So that leads up to our next category, which is clinical context use. And as Samir has talked about, you're the only one that's going to answer these questions, whether or not you should adopt a GPT for your preclinical use. And in this case, outside of time constraints, we also have to think about how easy it is to get the information you need to help it to provide you with the answer. Because keep in mind, GPTs are not integrated with your EMR systems. They're not integrated with your computer systems. So it's really up to you, like whether or not these informations are readily available to you for your personal use.
Yeah, absolutely. And so kind of to put it all together, I think, this is a framework we're hoping people can use once the GPT store comes out to kind of make some personal decisions about whether GPT is worthwhile or not. As we said, it's kind of really three big areas looking at the capability of it, the utility of it, and whether it fits into the adoption and workflow that you're doing. We hope that as the GPT store comes out, there's more research in this area, and certainly as there is, me and Michael would love to present that in our newsletter and maybe even revisit this as a podcast. But in anticipation about what's going to happen next year in January, we thought this would be a good follow-up video to the GPTs that we made previously. And as always, we're looking forward to comments, questions, and we hope that you follow us on the neural network and stay in touch, and tell us what content is important to you, because at the end of the day, our goal and our mission is to make sure that we're a relevant resource for healthcare practitioners in using AI tools and using it safely.
Great. So thanks for watching this.
Awesome. And happy holidays, everyone.